Warm welcome to everyone from Geneva, Switzerland. This is Minja from the Geneva Learning Foundation. I'm super pleased to welcome you to our third and final workshop on responsive feedback. Today is a Friday, and we're in week 3 of the Impact Accelerator Launchpad, where you're implementing field actions to improve immunization outcomes where you work. So before we start the workshop, I actually want to share a unique event for next Friday. So many of you this past Monday, you've heard from Rita and Charlotte about the upcoming Teach to Reach Connect 6. And in this one-day event, there is a special workshop that is planned on responsive feedback. You can see here on my screen. So I want to turn perhaps to Rachel and ask you, Rachel, what the session will be about, and would you invite the scholars in this room to join the session, and how do you think they will contribute or share their experiences in this special session at Teach to Reach? Rachel?
Yes, thank you. Yes, I believe that we're putting together an interesting session. Of course, the session will kind of go over some of the key themes that you've learned in the workshop, since we'll have people that are new to responsive feedback. But we'll be providing an in-depth example by Dr. Mohammed Lehman of a project that he's been working on. And so, first of all, I think that that might be a really nice way to kind of encapsulate all of responsive feedback and provide you with some new examples that can maybe help deepen your knowledge. And then we'll have some time for discussion at the end, in which we'd really love to hear from you, from the people who've taken the course, and some of the benefits that you found in responsive feedback. So I think it'll be a nice opportunity to kind of get a review of the concepts in a slightly different way, and more of a live setting, and then also just to have a little bit of a chance for you to share your experiences and benefits that you've had so far. So hope to see you there. Thank you.
Thank you, Rachel. And I want to share a specific link where you can actually click and then add it to your calendar, because these days we know you are busy professionals, and so if you click on the link that I just shared in the chat, you will be able to see a blue button, add to calendar, and you'll be able to put it directly in your calendar with the correct link to join when the day comes. So I highly recommend you to join us next Friday on at Teach to Reach to continue our discussion on responsive feedback and how it can help you in your field implementation. So I want to share a quick update. There are 88 scholars who already completed the module, the responsive feedback module, in your personal learning space before today. Obviously, there's a larger group of scholars who are taking the module, and this is the list of the 88 scholars. So if you see your name here, congratulations, bravo for completing the module. If you do not, however, I do want to quickly remind you that there is a deadline if you are thinking about getting the certification, and it is in fact today. So you've got, I believe, 8 more hours to complete the module. And the one thing I want to highlight here or point your attention to is there is a magic button at the bottom of each lesson, which is called Mark as Complete. So do not forget to let the system know that you are making progress with the module. Do not forget to click on this Mark as Complete button. And so once the module is completed, you can actually see that 14 out of the 14 lessons are completed, as shown here on my screen. So this is what your personal learning space should look like if you have completed. If not, if it's 12 out of 14, you probably have missed two lessons that you need to go back to and complete. And for scholars who, like Roberto, who just shared before the session during the social time, who are just starting using the final few hours to take the module, if you're in the room and you have not started yet, look for an email that you received from Professor Vish. In fact, from 3 weeks ago on a Monday, he sent an email invite, a special invite to have exclusive access to responsive feedback. So search for responsive feedback, this keyword in your email, and you'll be able to access the module if you still wish to. And obviously, if you're not thinking about certification and really just curious about the approach, you're free to do so even after today. So you can take your time to really go through the tools, the resources, and find out how it can help you. Unfortunately, Professor Vish has a last-minute conflict, so he's not able to join us today. However, this session, this workshop is stays the same, which is to support you in your field implementation. And you can choose to do two things. First, share your implementation challenge, or present your learning agenda, which is worksheet number 2 in the module. I want to pause here at this point and want to ask you if you would like to present your work. Please raise your hand, and this is how you do so. So at the bottom of your Zoom screen, you can see the reactions button. Once you click on that, you'll be able to raise hand. So I see Mela's hand is raised. I encourage especially those of you who have not been able to present your work during the past 2 workshops, or even the Monday general assemblies, that if you have not had the opportunity to share with your colleagues, this is the occasion to do so. So let me go to Meles. I know Meles, that is not I want to invite you and come back to you, Meles. Would you like to share an implementation challenge, or would you like to present your learning agenda?
Okay, thank you. Better to share my worksheet too.
Okay, would you like to share your screen?
Okay.
Okay, I'll stop share from my part. And so you should be able to do it now, Meles. And before you start presenting, do not forget to introduce who you are and where you connect from, and let me know if you're able to share screen. Otherwise, I can share for you, because as admin, I can, let me see, I actually already have it. So let me start sharing. Meles, I think this is yours.
Yeah.
Okay, so the floor is yours, Meles. If you could start by introducing yourself, and then walk us through exactly what your learning agenda is about, and what assumptions and what learning questions are you looking at. Over to you, Meles.
Okay, thank you to give me the opportunity to share my responsive feedback module to the colleagues that's just in this meeting session. So I was actually focused to address the zero dose children in Ethiopia, which is aggravated due to the emergence of this pandemic. So my challenge actually addressing the zero dose children. So to address this challenge, I identified 3 specific activities to be implemented in collaboration with other key stakeholders. So one was integrate COVID-19 prevention in the routine immunization outreach service will be organized to address zero-dose children. And second specific objective that's planned to be implemented was community mobilization will be conducted to bring their children to the healthcare facilities for immunization, including school education for creating awareness on the COVID prevention. Third objective was actually strengthen the monitoring and evaluation activities to assess the effect of the integration or the impact of the integration of these two interventions. So that's COVID prevention as well as immunization integration. So to just see this in detail, I used it to the response feedback module, which is actually helpful to me to identify the challenges that may be faced during the implementation activities, and also see the opportunities that may be helpful for the better output of this action plan, and also helping me at the same time. It's helping me to see for potential stakeholders that is really impactful for this implementation activity. So the first activity that is actually in the action plan is integrate COVID-19 prevention in routine immunization outreach services. So in this activity, the assumption was actually healthcare providers and healthcare organizations are interested to conduct integrated outreach immunization service. And also the assumption is huge demand of financial, logistic, and human resource for integrated COVID-19 and routine immunization service. Again, another, can you go down, please? Yeah, the other mothers and caregivers in this community are voluntary to use the integrated outreach service of immunization. So these are the assumptions. And when we go to the learning questions, or may I use my computer for otherwise maybe somewhat Zoom? Yeah, that's good. So as the learning the learning questions that's developed from the assumptions were actually what are the most effective way of motivating the healthcare providers to provide integrated care, integrated outreach service in immunization. So it's a really very important question that we have to know what are really the motivating factors for healthcare workers, as well as what are really important to just convince even officers or
it sounds like you stopped hearing from you.
Hello?
Right, okay, you're back. We just lost you for a split second, but you're back.
Okay, good. So let me start from the learning questions. So the first learning question that is very important to clearly understand is that what are the main, the most effective way of motivating the healthcare providers and officers in integrating these two huge programs with huge resources. So this is actually really significant and also really feasible. If we know their motivate factor enough, it's really important to properly implement the activities. And also, if we know their interest is feasible to go to address their demands even. So to address this responsive feedback learning question, it's good to have a qualitative interview with healthcare providers like focus group and key informant, as well as it's also very important to go to see the monitoring and evaluation reports also. As a resource for COVID-19 prevention and control activities is available resource that's actually that's actually used for COVID prevention. Additional, there should be a resource that's really important to strengthen the integration activities, the outreach activities that actually address both the COVID as well as the routine immunization. When we come to the second assumption, that is huge demand of financial and logistic and the human resource for integration of COVID and routine immunization, because it is a national as well as a huge program. It needs huge resource and also not only actually financial resource, but also there is a need of human resources, need of logistics. So could the resource available for COVID-19 prevention enough to conduct integrated outreach service? This is actually the question that should be in our mind when we are going to integrate these two programs. This is actually significant and also high feasibility. We have to conduct assessments on the previous financial reports and available budgets at the same time. So we need to know how much we do have in this COVID prevention activities. As available resource, it is actually similar from top to down. There is COVID prevention control resources, that is countrywide resources. And also at the same time, there is a need of additional resources that really important to strengthen, that will be used for mobilization, that will be used for transportation and any logistic available expenses. So there should be available additional resources from potential funding organizations like organizations that's really focused on immunization like Gavi, UNICEF, and also WHO at large. Yeah. For this huge demand of financial and logistic, this huge resource, there's another actually learning question. What is the possible way of convincing the funding organizations? So the funding organizations or funding agents need to have actually a convincing factor to just motivate to just help or to assist by funding. So there should be an evidence that tells them they should be just part of this intervention or part of this program, so that to address the needy groups or the gaps in immunization, especially during this COVID period. So this is actually significantly high, and also the feasibility is high.
Melas, sorry to interrupt. Thank you for walking through your learning agenda, really clearly explaining your assumptions, what each of your learning questions are. There are at this point, I want to encourage everyone in the room, listen carefully to what Meles has to say, what remaining part that you have to finish your presentation. We'll be turning to you to share your feedback and comments to help Meles Tafari to improve his learning agenda. So Meles, at this point, I want to ask a question, which is, can you tell us of all the learning questions? I know there are a couple, and for example, that is just for activity 1. You also have got activity 2 and activity 3. It's really a comprehensive learning agenda, but I want to focus on activity 1 and ask you, what is the one learning question that is the most urgent for you to answer? And we'll be open up the floor for your peers and colleagues to share their feedback then. Can you help answer that question, Meles?
Yeah.
Actually,
the main activity for this integration is integrating these two programs, that's COVID prevention and routine immunization services. So when we are going to integrate, it's really important to know the effective way of motivating the healthcare providers, how we are integrate, who is actually responsible, for what they are responsible, and how with, if any benefit even. So we have to think of the effective way of motivating the healthcare providers to provide integrated outreach service. And also another main and very important question is that when we are integrating two programs, we have to know the resources that are available to be used. So we have to know what resources, could the resources available for COVID or any available resource is enough for to integrate the outreach service, and also if there is any additional resources, a need of additional resources, in what we were just motivating, or who is actually going to just fund, who is going to just where we are going to just find resources is very important question. So we have to know that the available resources, and also we have to know who is really the potential funding organizations that may be helpful for us. So this is very important questions to be addressed.
Right. Thank you, Meles Tafari, for sharing your learning agenda and for walking us through it very clearly. So I would like to turn to the room, to your colleagues in the room. I see multiple hands raised. I want to ask, perhaps turn to Dr. Kaushik Nag first. You have your hands raised. Kaushik, can you help introduce yourself first and then share with us what feedback or comments do you have after you've heard the learning agenda from Meles?
Hi, good evening, everyone. I am Dr. Kaushik Nag, Faculty Community Medicine from India. It is a nice project which Meles is working on. And, he wants to integrate the COVID-19 prevention and routine immunization outreach service. So why he wants to integrate it? Why the routine immunization is not going on separately? That's my question to him.
Okay, thank you, Kaushik Nag. So, Kaushik, you asked the question, why does Meles want to integrate? Meles, perhaps I can go to you first before I go to Dr. Subarna Singha for his comments. Meles, can you help answer Kaushik?
Yeah, thank you for the question. That's actually important. From the beginning, I tried to just explain we have a challenge with huge zero-dose children. So to address these huge zero-dose children or disadvantaged populations, it's very important to use the available resources that's given for COVID by integrating to just boom the routine immunization program. So there is actually a huge zero-dose children. So to address these zero-dose children, and also the main reason for this zero-dose children, especially for the last 2 years, is the pandemic, that's the COVID pandemic. Because of this COVID pandemic, most of the healthcare providers moved to turn to the COVID prevention, and resources are moved moved to COVID prevention and leave behind the other routine activities. So instead of just leaving that group, it's better to integrate these two and try to just address these huge zero-dose children. So the available resource that's given for COVID is very important to help other routine healthcare immunization activities, routine immunization activities. So that's why I'm just going to integrate.
Thank you, Meles. There's a question in the chat from Ahmed Neama, who asked, what are the community response regarding COVID-19 vaccination? This is an important question to ask ourselves because vaccine hesitancy is wide. And he then further added, the beneficiaries here are the community. So I want to go next to Dr. Subarna, because your hands is raised. And I want to encourage others, especially those who have not been able to speak, to share, and who have raised hands before. I want to also hear women in the room, whether what feedback, what perspectives, what things you would like to share with Meles from your perspective. So let me go to Dr. Subarna first. Dr. Subarna, your hand is raised. Are you able to activate your microphone?
Hello.
Hello, Dr. Subarna. So can you introduce yourself and share specific constructive feedback to Meles to help him improve his learning agenda, as you can see on my screen here?
Hello, am I audible?
Yes, loud and clear, we can hear you.
Okay. I am Dr. Subarna Mahapatra. I am a public health specialist working at Paschim Bardhaman district of West Bengal, India. My specific comment regarding this, I have one query. In the resource needed, there is no mention of any researcher who will conduct the qualitative interview, and there is need of some training to do qualitative interview. It is a specialized job, so I think this should be included in the worksheet. This is my suggestion to improve this worksheet. Thank you.
Okay, thank you. I want to go to Ndayo. Ndayo, you have your hands raised. Are you able to unmute?
Yeah, thank you, Zah. Thank you so much. Thank you, everybody. Thank you, Mary, for this presentation. And I want to, first of all, introduce myself as Dr. Iwot Ndayo. I'm the immediate past Executive Secretary, FCT Primary Care Board, Abuja, Nigeria. I've been on immunization programming for over 25 years at both operational levels and sub-national management level of operations. And I'm a scholar with the Geneva Lady Foundation and a member of the IA 2030. Yes, Zah made a very important observation that there are so many learning questions for each activity that we're supposed to prioritize and then take one and elaborate. So that's very important that you do. Then secondly, about integration, it is good that we know very well that is a global concept to strengthen uptake of both routine immunization and COVID-19 vaccination. Remember that COVID-19 pandemic response is based on the one authority response for each country. That is the EOC, the Emergency Operations Center. And there are 9 pillars without vaccination pillars. So now World Bank is providing resources for a country to have vaccination pillar and they are funding that. So they want a situation that resources available for COVID-19 pandemic will improve on routine immunization, where it has been demonstrated practically that outreach services are hindered or hampered by non-fulfillment of planned outreach sessions. So following that, it is expected
is breaking.
that with one family approach or it could be made cost-effective approach. Following that, you have to now coin your learning question to reflect this, because it is a beneficial activity and is going to form from integrated micro planning to embrace both activities, and then the resources that you will use and how to engage the stakeholders, particularly on the demand side. Thank you so much, Anova.
Thank you a lot, Ndayo, for those comments to Meles. Meles, I hope you're listening carefully. I just want to encourage those. I see more and more hands raised. Meles, your colleagues who are eager to share their feedback to help you improve your learning agenda. So in the interest of time, I'm just going to invite one more person, Ahmed and Neoma, and then encourage the others. If you do have constructive feedback for Meles, please type in the chat. As I see Luzige, Kosia has done so already. I want to go back to Ahmed. Ahmed, what perhaps you introduced yourself during the social time. Can you present yourself first for those of us who don't know you, and share your feedback for Meles? Ahmed?
Hello, everyone, and hello, Meles. Sorry to interrupt, but I want to congratulate you on this great efforts you put in the activities. Is just one question to ask, because the integrating the COVID vaccination with child immunization has it's two-sided effect, because it depends on the acceptance of COVID vaccination in the community. The final beneficiaries of this project will be the community. So there was any focused group discussion with the community or any survey of the COVID acceptance? Because in case they have vaccine hesitancy regarding COVID, that will affect in the drop of the coverage of the child immunization, because people start linking between the two vaccination programs.
Okay, thank you, Ahmed. At this point, I want to go back to Rachel. Rachel, you have heard Meles' learning agenda. If I can go back, he's from Ethiopia, and he's working for an organization, a research organization under the Ethiopian Ministry of Health. In fact, he's a researcher, and this is, we just heard one of the activities he's planning for his project. And you've also heard peers' comments for him. What comments do you have, Rachel?
Hi, yes, thank you. And if you wouldn't mind scrolling back down to the activities page, I think this obviously shows that you've been thinking about many of the different facets of this activity. And I see, I haven't had a chance to look at your other activities, but those as well. And I think that these are all in the right frame of mind, because definitely these are two very key issues on making sure that you have the buy-in from the health providers that would be helping to administer these services, and also making sure that the program that you're trying to integrate, I think that's a key question, is are these resources available to kind of share between the two kind of programs? And I think that you've gotten some really useful comments so far, and just maybe even another kind of pre-step to some of these is making sure, and then you might have more of this information that we haven't had a chance to get to yet, but that you understand what's keeping people from getting vaccinated. And I think you did mention that a lot of it is because of the pandemic, and that there's been a lack of providers. And in that case, it does make sense to link these programs. But I do also agree with some of the comments that you received to just make sure that linking these two programs isn't putting routine immunization in with any COVID misperceptions or mistrust and vaccine hesitancy, and making sure that before you link these, it might be a valuable step to probe as well. If you don't have this information available, if there are any of those other reasons for hesitancy, and if some of them are linked to COVID, and making sure that by linking these programs together, you're not, increasing hesitancy or undermining the efforts of childhood vaccination. Just thinking too that, by combining these two groups, depending on, if the focus for COVID-19 vaccine is mostly on getting adults vaccinated, or adults and older children vaccinated, and then the routine immunizations, if that's focused more on younger children, those are might be two different audiences, and obviously you'd be targeting the parents of those young children. And so just making sure that you understand all of the different audiences and groups that would need to be kind of on board with this vaccination as you're kind of moving these things forward. And I think that you already have some really good questions here, and if you are planning to move ahead with this kind of healthcare provider and organization interest, they may also be a really valuable source in these qualitative interviews, to helping you answer some of these questions of not only are they interested in this, but how much of a demand would this be? What would your day look like if you were going to integrate these services? And also what have you experienced in the community, and asking them some of the feedback that they've gotten, or some of the hesitancy maybe that they've seen both towards COVID and some of the challenges that they've witnessed towards childhood vaccination. So I think wrapped up within some of these questions, if you are going to be able to have the resources to conduct some of these qualitative interviews with healthcare providers, if that will be your focus, tapping into some of these other issues within that session of, how would this impact your day? What resources, what do you feel the resources would be needed? And, how have you experienced hesitancy in the community? What do you think the reasons are for zero dose children, and what other reasons have you seen for vaccine hesitancy? So you might be able to kind of address a couple of these in these qualitative interviews, or even just talking around with some other healthcare providers or community leaders that might be in a good position to give you some of this information. So yeah, I think you're on a really great track here, and just thinking through, I think, some of the valuable feedback that you've gotten, to make sure that you have all the kind of background reasons for either people getting vaccinated or not, and kind of accounting for that as you move forward with this would be useful.
Thank you, Rachel, for that feedback. I want to go back to Meles. Meles, what is your reaction after hearing those feedback?
Well,
yeah, Meles, we can hear you. What would you care to share with us? What is your reaction after hearing Rachel's comments, as well as many colleagues' comments previously?
thank you again to give me the chance to just share my reaction. Maybe actually, if you go to the activity 2, the second assumption is actually there is unexpected challenge that maybe the perception of the community when we just integrate the COVID-19 and routine immunization. There may be actually just there's a negative impact, maybe huge negative impact if the community mobilization activity, awareness creation activities are not well done. But to just mitigate this problem, to mitigate this misconception, we design, I design actually different methodologies to address the community, to create awareness, even including school education, including community mobilization in different ways, using even stakeholders like religious leaders, cavalry leaders, including respected individuals that just concerned to the community to just give their intention to increase their awareness. So yes, when we integrate these two programs, there may be actually challenges that may be, but when we just evaluate the challenge and the benefit, there is a huge difference. There is a huge benefits and challenge that we'll face. So to address this challenge, we need to design different methodologies, even different way of contacting the community in addressing mitigation, the challenge that may be faced during implementation activity. So this is one.
Yeah, thank you, Melis, for sharing those reactions and the thought process you are going through. I see there are many comments coming in for you in the chat. For example, Tina Agbonima shared one comment. My feedback to Melis is to look at the impact of the stakeholders. Have you had any planning meeting with key stakeholders of these two programs? Are you getting the necessary support to integrate COVID-19 and routine immunization activities? I advise you to look at these areas, and thanks for sharing your learning experiences. And there's more comments. I would encourage you, Melis, to read.
Yeah, I'm just seeing the comments.
Yeah. Okay, thank you very much, Melis. I'm going to stop sharing my screen.
Yeah, actually, to just reflect on this.
So right now, I want to invite another colleague in the room, another scholar in the room. I see a long series of names. So one scholar, you have your hands raised and we can see you right now. You have your camera turned on, but your name is shown as a long series of letters and numbers. So 1EM6V0S. So I wonder if you are able to, this is a hand to present or share your implementation challenge. Okay, it seems like this may be a hand by accident. So I want to go next to Hassan Benya. Hassan, you have your hands raised. Are you able to unmute?
Yes.
Okay, great. Would you like to share an implementation challenge, or would you like to present your learning agenda?
Well, let me share the, I think I've done the implementation. Let me share the agenda.
Okay, so
let me share the agenda.
Let me stop sharing. Please go ahead, Hassan.
Okay, so let me just see. Where is it? Okay, this. Oh, okay. Open. Okay. I've not been able. Okay, it's saying trying. Unable to load the whiteboard.
That's okay, Hassan. I've been able to find your
oh, okay. Okay,
by looking up your name in the folder. I was able to quickly find it and open it for you. I believe this is yours, correct?
Yes, exactly. Thank you very much. Yeah.
Okay, so, before you start, Hassan Benya, can you share with us who you are, where you work,
okay.
and then walk us through, and be brief and concise, please, and focus on perhaps on the learning question. Here, the one, this is empty, but share with us what is the one learning question that you're focusing on, that is urgent, that is important for you. The floor is yours, Hassan.
Okay, so my name is Hassan Benya. I'm based in Sierra Leone. I'm working with the Clinton Health Access Initiative, CHI, as the senior analyst.
At least for me, I'm not hearing Hassan Benya. Hassan? we're not hearing you. Are you able to double check your connectivity, perhaps?
For vaccines and data management.
Okay, Hassan, we just heard you but lost you again. So let me just type in the chat so that you know as well. Let's see, try one more time, Hassan, if you are able to, let's see. If you are able to unmute. And
okay,
then...
okay, sorry for that. Hassan is back. So okay, as a result to that, yes, as a result to that, these are the key activities I really want to do. I want to improve completeness of vaccine recorded in the stock ledger. I don't know how many of you guys know about the stock ledger. In Sierra Leone, we use stock ledger to document our commodities. You know, the role of the stock ledger is to document in and out of the vaccines within the facility and outside the facilities. So again, the other second point, I want to improve data completeness of vaccines recorded in the RI, which is the request, report, and issue voucher. Then also the availability of vaccines reporting tools in the 10 facilities, because I tag these 10 facilities because I have a deadline from, I think it was from last week to the 17th. So I decided to start with 10 facilities at the moment. Then again, I also want to do vaccine forecast. You know, vaccine forecast is another point that we notice that if we forecast, there's a possibility that we can reduce stock out at facility level, and then it also increase coverages. Then also the other thing is we want to reduce stock out of vaccines at health facility level. So then the other main outcome is I want to improve the knowledge for data entries among EPI focus in the health facilities. You can move down. Then the activities for me to embark on in the next, for over the past 2 weeks, I've been focusing on engage stakeholders at national and district level to focus on the supply chain intervention, and then select health facilities for the data documentation interventions, and then also develop a feasibility baseline in the selected facilities. I think this is currently what I'm doing, but the downside is I've been able to engage the national EPI program, and then also I've been able to call 1 or 2 facilities. The only challenge I'm currently with is for me to develop the tools and then start the assessment. So I think I need the green light from the national EPI program first for them to give me the green light before going to the district. I think that's all I have for you. Sorry that I never noticed that there is a document down here which I have to fill. That was the mistake that I did. My intention was just that particular information. So over to you. Thank you.
Thank you, Hassan. Actually, that would be an interesting conversation to have. If I could ask Rachel here to perhaps have that conversation during this session. What are your assumptions? And then what is the learning question? Rachel, would it be okay if I put you on the spot and would it be okay for you to have this conversation with Hassan to focus on his program activity, on one of the activities? Rachel?
Sure. So I guess just a question here. So when you say that you need data completeness of the vaccines recorded into the ledger, so is it a problem with individuals not actually like they're not accurately recording things, and so there's not completeness because the people who are supposed to be recording are not doing so for some reason?
Yeah, I think, Richard, that has been one of the biggest challenges we're having across the board. So currently, the stock ledger are available, but in terms of accounting for the stock that people use, that one is really poor. When you go, the stock ledgers are available at facility level, but in terms of using it, people are not using it. One of the major challenges they are talking about, one is the knowledge gap. That's one. Then 2, because of workload, these guys cannot actually do. Then 3, you know, it's just like laissez-faire. Sometimes, you know, inertial behavior that leads to that. But other than that, definitely, it's one of the key challenges. And as a result, we find it very difficult for us to really be able to ascertain the type of vaccines people are utilizing. That's the problem.
Okay. And so as you've engaged stakeholders, and you said you've done some of this so far, and so are you have the reasons that there's people are just not aware of how to do this. They're having too much work, and then sometimes they're just maybe omitting this step. And so do you feel like as you're getting these things ready for the intervention, that you have a kind of a clear understanding of the reasons why this is occurring, and then you're going to kind of address those? Or are you still at the phase where you kind of need to understand more about what these barriers are? Or
yeah, I think just like I said, the barriers is one, the knowledge. That's the major barrier. Okay. Then the second barrier is the availability of the tool. That's the second barrier.
Okay.
Then the third barrier is I would say inertial behavior, because inertial behavior will actually drive all these two, which I've just said. Because even the tools are available, but if the behavior of entering data is a key, definitely people cannot do. And we just completed an assessment which is on data quality. So from the data quality assessment, which is not part of this, I noticed that vaccines received, vaccines issues, stock, the amount.
It looks like Hassan may be encountering the
discarded, all these information cannot be seen. After this. Hello?
Okay. Yeah. Thank you. You cut out a little bit in the middle there, but I think from what I got is that you have kind of these main buckets.
Hello?
And
Ma'am, I didn't call you back. I didn't.
Oh.
Hello?
Yes. Yeah, we can hear you, Hassan.
So that's the point I was saying, you see. So these are all the issues that I know, and I've actually noticed that it has to be done. Yeah. Although for now, the leadership level, they have to approve. For me, I'm coming from the partner perspective. I need to get approval before going down. So up to date, I'm still worried again for the 17, because on the 17, I'm supposed to really present this information to the big land. Up to date, I've not been able to get the approval to go down to these facilities to do the assessment. So I think that is the biggest assumption now I'm having, because if the leadership give me the go ahead, definitely, then I can start the assessment. But until that acceptance is being given at national level, then when I move to district level, definitely I'll do the assessment. But that's what's up to date. The 70 is closer now. So that's the biggest problem I'm still having. Over.
Okay, so you're stuck at this kind of stakeholder level of getting that approval so that you can kind of start at your next steps. Sure. Okay, and so I think that if you are able to hopefully present some data in a kind of compelling way of some of the things that you already know, and I'm not a subject matter expert, of course, in dealing with these particular stakeholders. So please feel free to chime in the chat, everybody. But just using some of those tools at least to get them all kind of sensitized to your issue, and understanding the priorities and needs of the stakeholders, and how you can make a compelling case for why this is so important. Some of the known barriers that you've seen, and it seems like there's some barriers that seem to come from the individual level, from the actual people that are supposed to enter it, but it sounds like there's a lot that are kind of organizational barriers as well. And maybe if there's more training on more making sure that these ledgers are available, that there's more training, maybe that there's some sort of incentivized process for getting people on board, like there's some sort of incentive for being up to date on entering these ledgers. And that there's a lot of things that you could work with these kind of hospitals on, or these facilities. But if that requires that this initial sign off, you could just start to think through some of these kind of initial things. And it sounds like you're really at that stakeholder engagement and building stage. And so, I'd like to turn to anybody, if that's okay, if that kind of has more experience in how maybe to engage these stakeholders in his situation to get the buy-in and sign off so that he can move forward. Because I think that seems to be the main area now, is presenting that compelling case and finding that strategy to get him that approval that he needs.
Exactly, Rachel. So I see multiple hands raised. I want to go to a female scholar. I want to go to Professor Becky Tagbo. Professor Becky Tagbo, can you briefly introduce yourself in one sentence and share your experience to help Hassan with stakeholder engagement?
Yeah, thank you, Zach. Thank you, everyone. Hassan, thank you for the wonderful presentation. My name is Becky Tabo. I'm a professor of pediatrics and vaccinology. So I want to suggest to you, because in the responsive feedback, we were asked to, itemize our stakeholders, and then we're also asked who our collaborators were. I think in the implementation action plan. So I suggest that you make this your stakeholders, your collaborators as well. By when you bring them in as your collaborators, they have a buy-in into your program, so they don't stall it, because you really have a time limit. The example is that what I did in my own case was that I brought in my boss as a collaborator, so she becomes part of the project. And then I brought in a colleague. So getting approvals became, straightforward. So if you can bring in the key people as your collaborators in the project, maybe that can fasten up your project. Thank you. Over.
Thank you, Professor Becky Tagbo. Next, I want to go to Nelson Albert. Nelson, your microphone is unmuted. Are you able to speak? Nelson Albert.
Thank you for giving me this opportunity to present myself. I am so impressed with the presentation that I'm seeing over my screen. Within 2 hours, I'll be for a coordination meeting with some other stakeholders within the location of operation. So we noticed that there is the constraints that makes immunization, COVID-19 immunization, is not so effective.
Nelson, thank you.
Yeah.
It's very good to see you on camera and hear you at the same time. Here we're helping Hassan Benya to with his challenge of engaging stakeholders to achieve his goal. You have heard his presentation, as you can see on the screen, and he's challenged with stakeholders. Do you have any experiences in terms of overcoming barriers or challenges with stakeholders to share with him?
Yeah,
Nelson?
I have experience. Yes, I have the experience. We noticed we have of poor roads, will not be able to reach the community, maybe people who are supposed to get the information because there is insecurity issues. At the same time, the roads are not clear. So transportation of community workers, rather it stops to the location identified that needs the services, it's a little bit very hard.
Okay, thank you, Nelson. I want to go to Ndeyo next. Ndeyo, what experience can you share in terms of engaging stakeholders with Hassan?
Thank you very much, Zah. Thank you, Zah. I want to appreciate this opportunity again. I'm in Abuja and working in immunization primary healthcare landscape, and I want to appreciate Hassan very sincerely. He's working in Sierra Leone, and with the Child Foundation. He's been on the programming by the Geneva Learning Foundation, the scholar, and then on the IA 2030 movement. Hassan, you are doing a good job. Where you are now is very fundamental, and you must address this issue. To get into the facilities. Facilities in Sierra Leone, are they not managed by the district authority? Because you are working at the national, are you supporting as child, you are supporting the national API, or you are supporting the subnational. If you are supporting the subnational, it will be easier because primary healthcare facilities are managed by the districts. So if you don't need clearance from the national to get to the facilities. So if you can collaborate with the district authorities, I think it will be easier for you to get, because if you don't get this step right, if you don't get to the facility, there's nothing you can do on this programming. And those, as you observe, the days are counting down, and you are learning worksheets has not been properly, populated. So there is need that you move quickly, establish who is the authority in charge of the operational levels, and then get this thing done, because you don't need ethical clearance in this situation. You don't need, in fact, even though you need ethical clearance, it will still come from the district. I don't know how Sierra Leonean health authority is organized, but if it is organized like the one we have in Nigeria, and the district is in charge of this, then if you need ethical clearance to go for data in the facilities, that should be this district. Even when you have the one from national, still have to obtain the one from the district. So quickly get in contact with the in charges. You have 10 facilities, so identify those that are managing those facilities, and then have excuses. If you are not involve your boss, you inform your boss that this is what you are doing, and then get down there and get this data from the service points. That is my own advice for that. It is urgent, and you have got to do that quickly. Congratulations on this decision that you have taken to work on that area that will improve immunization. Thank you, and God bless.
Thanks a lot, Ndeyo, for that piece of advice. I see more hands raised, but in the interest of time, for example, Samuel, Melis, and others, if you have further comments, please type in the chat to let Hassan know how exactly you can, what experience you can share to help him solve this challenge with stakeholder engagement. I do want to say to everyone in the room, thank you for staying over time. We're 3 minutes over the originally scheduled time, for staying in the room to support your colleagues to make progress to overcome their challenges with immunization. And I want to take 2 minutes just to walk through some of the next steps. I know that many of you in the room are actively taking the responsive feedback module. There is a deadline if you want to gain certification, and it is today. So you have, I believe, 7 or 8 hours left to complete the module. Second, there is a very short, I believe 8 questions, post-module questionnaire. The questionnaire will close on Monday. So we have received many very interesting feedback some of you have shared, and we would love to hear from each and every one of you what has been your experience with responsive feedback and what you plan to do with it, how exactly you're going to use it to improve your work. Just one quick word, remember to track your progress on in your personal learning space. It should be 14 out of 14 lessons complete. If you want to gain certification, this is how you track your progress, by marking, going to each lesson by marking each lesson as complete. And then 69 scholars actually shared already your feedback for the post-module questionnaire. These are your names. I want to acknowledge and say thank you for sharing on behalf of the responsive feedback team. And in fact, if you have completed the module, you will receive a personalized link for this post-module questionnaire, which is, you need to go to that final lesson called Final Message, how to continue improving using responsive feedback. Vish has a very simple message for you. And as soon as you click on Mark as complete, you'll be able to receive the email you see on the right, including your personalized link to share your feedback for the module and for the responsive feedback. And I want to share just very quickly, these are what the other colleagues have already shared. So some of them shared more than once. So here you can see it's 80 people. Have you started to use responsive feedback in your work? 92% of you have already said yes. And many of you said, in fact, 100% of you have said you will recommend the responsive feedback module to your colleagues. And so in relation to this, if you joined late in this room, there is a unique opportunity to continue the discussion on responsive feedback at Teach to Reach Connect 6, which will take place next Friday, June the 16th. And so there is a 1-hour session with Rachel, I believe another colleague, who will share a very specific example of how responsive feedback has been helpful and used to support his work. And it's at 3 p.m. Geneva time, and you can use this little icon to add it to your calendar. Another way to do it is to go to this link. So I just copy and pasted it in the chat. If you click on it, you'll be able to open up and see this screen that you can see now on my screen. And there's a blue button, add to calendar. You can add it to your own schedule and you'll be able to get the link to join on the day next Friday. So I want to pause here and yeah, turn to Rachel or maybe Courtney. I see Courtney has also joined in the room. Do you have any final messages to share? This is our final workshop in terms of the module. Although next Friday we will have the special workshop at Teach to Reach. What messages would you like to share with the scholars in the room? Some of whom have already completed the module, some are still making progress. Maybe there's a small group who are, curious about it, but haven't really started. What would be your message to them, to the scholars in the room? Rachel, maybe I'll go to you first, if that's okay.
Sure. Just like I said last week, I just want to congratulate everybody for taking this course, and through all of the comments, through all of the weeks, it's been really clear that you've really thought through a lot of these issues and that you're working well with thinking through your assumptions and doing all of these things. And, I think we showed the curve process on the screen before, and just thinking through that while there are a number of steps, they often kind of link together. And so as you heard today, those stakeholders come to be important in so many ways throughout. And if you have a group of stakeholders that you can include in pause and reflect sessions or get their feedback, I think that's a really useful way to get understanding for your program. And the more you understand about their priorities and where they're coming from will help you better connect to them and understand how to get their buy-in and support, and just how important that is. And just encourage you all to keep looking at those learning opportunities. We've heard so many great suggestions on ways to think through potential areas to focus on, and all of the different ways that you can think through the context and environment. And I just think everybody's doing a wonderful job, and I want to congratulate everybody and thank you for your time these past couple of weeks and all of your insights. And so it's been a pleasure. So thank you. Over.
Thanks, Rachel. And I'm sure scholars, when they join next Friday, they will be able to continue that discussion with you and the rest of the Curve team. I want to turn to Courtney, who just joined for the first time, but I hope you were able to follow along, Courtney. And what would you like to share with scholars in the room?
Of course, yeah. I'd just like to say thank you so much on behalf of everyone on my team at the Curve, because this is my first workshop and this was super interesting, and it's really, really great to see how everyone is engaging with this topic. So thank you all, and a huge congratulations to everyone, especially those of you who have completed the module so far. I would just like to reiterate what Rachel said about joining the Teach to Reach as well, because you'll be hearing more from Rachel and Dr. Lehman for some practical examples of case studies and how other people are implementing responsive feedback. And I think these lessons are amazing to learn from, and also opportunities to ask questions. So yeah, thank you to you, Jar and Reda, and to you, Rachel, for your time. But thank you, everyone, as well. Congratulations.
Thank you. And I see Reda is also in the room. Reda, if it's okay to turn to you for the final comment before we wrap up the session. Okay, it may be that Reda maybe it's not convenient for him to speak at the moment. I want to really invite everyone to join on Monday, of course, for the General Assembly. Next Monday is going to be the final General Assembly for the Impact Accelerator. And if you have not already done so, remember to share how the action went for this week. And of course, Teach to Reach is going to be an exciting event for all of us. And I look forward to seeing you there, as well as many other health professionals from all over the world. So with that said, I'm just going to try the ask all to unmute. Thank you for joining. Wishing you a very good evening, afternoon, morning,
Thank
wherever
you.
you are.
Thank you.
everyone.
Thank you. Thank you.
Good night. Restless.
Thank you. Thank you.
Bye-bye.
Thank you very much.
Bye.
Bye-bye. Bye.
Bye-bye.
Thank you.
Thank you. Bye.
Thank you,
Thank you.
everyone.
Thank you,
Thank you, everyone.
Bye. Thank you. Good night.
Bye. Have a good weekend, everyone.
Night.